So if you ever look at the description I gave myself on my Instagram handle, it says, a board-certified plastic surgeon tailoring the approach to your individual lifelong aesthetic health. Those three words really mean a lot to me. Let's break them down. So lifelong aesthetic health. First of all, lifelong. What that means to me is that we want to make medical and surgical decisions for the patient which give us a desired aesthetic result now, but also a result that is fairly long-lasting, not something that's going to burn up in 2 or 3 months or years. We want to do a surgery in a way that we don't burn any bridges for future surgeries or for future corrections, and that has to do with incision placement, has to do with blood flow, and deciding where the incision is going to be so that we can set ourselves up for success for the next surgery should the patient potentially need it, several years or several decades down the road. And also minimize the likelihood of future surgeries. I mean, anytime we do aesthetic surgery, like if you take breast implants, for instance, as you know, I do a lot of implant removals, and I see a lot of pitfalls that the original surgeon has done, such as maybe they made an incision in a way that cuts off blood supply for future lifts in the interest of a short gain at that time. So a lifelong result considers the immediate result, but also how long that result is going to last, but more importantly, what's going to happen afterwards. So that's lifelong. Aesthetic, obviously, we're plastic surgeons, so we're going to focus on the aesthetic result. We want the patient to be happy with their result and how they look, but aesthetic health, as in like we want them to be healthy as well. We don't want the appearance to interfere with the patient's well-being or the patient's function. I want the patient to feel healthy as well in that new look. Re-examining the breast implant scenario again, a lot of patients are very athletic, so to put an implant under the muscle may interfere with certain movements or certain exercises that they do. So we'll have that discussion. We'll basically say what is the best implant for you or what is the best placement of the implant. I'm usually on the other end of things. I usually remove them, so that makes patients feel a little bit more at ease and a lot more athletically inclined and capable after we remove them. And then we just basically do the best thing we can for them as far as volume and shape. Sometimes they get a lift so to feel more comfortable. Sometimes they just prefer their natural look. But health is important to me in order to combine that with the aesthetic result that we're going to get. So that's my definition of lifelong aesthetic health.